So good afternoon, good morning. Welcome everyone. Thanks for joining today. I see some very familiar names, so thanks for joining. And for those learning for the first time about the map, thanks also for joining. The session today is going to focus on the eCOVID living recommendations map. Please feel free to bring in questions using the chat box. And at the end, we'll take 15 minutes for a Q&A. The plan is to take you through this map and show you a demo and that we cover our objectives for today. I will share the link to the map in the chat box so that you can all access it while we're doing the demo. And I will turn my camera off while doing the demo. Just to start, my name is Tamara Lotfi. I'm a research associate and project coordinator at the Health Research Methods, Evidence and Impact department at McMaster and at the WHO Collaborating Center for Infectious Diseases, Methods and Recommendations. I'm one of the co-leads for this project, and I'm happy to take you through the demo for today. So to start, we'll just make sure that everyone has the link in their chat box so that you can access the map. Great. And so before we begin, we wanted to get some information about you, mainly about where you are based, in what region or in what country. It would be very helpful if you can send those in the chat box. Unfortunately, the polls are not working well today. So if you can just tell us from what country you're joining us. Great. Great, we have people from everywhere, so welcome and thanks again for joining. The only second question, I promised, second question is in what capacity are you joining us? So are you a health researcher, a public health professional, a healthcare professional, guideline developer, COVID-19 patient, a member of the public? So if you could just let us know in what capacity you're joining us today. All right, great to see that we have some diversity here. So it's very important to know that, depending on our capacity, we will be using the map in different ways, mainly because we'll be looking for different information. And I'll try today to take you through the different aspects. If there's anything that you are specifically looking for that we were not able to answer, please do feel free to express it or ask us for it, and I'll be happy to help out. So to start, the COVID-19 recommendations map and gateway to contextualization is part of a project that's funded by the CIHR, and it's accessible, it's freely accessible to anyone globally. It builds on our previous work on the ETB, so the tuberculosis recommendations map that we developed for the WHO Global TB Department. Our goal behind this map is to provide a go-to place for anyone seeking evidence-based recommendations on COVID-19. This tool is freely accessible, the content is living, and the interface is user-friendly. And just before we go through details, I would like to start by saying that this work is a fruit of a multi-institutional international collaboration with a large team behind it that's making it possible to keep the content as relevant as possible and to provide exclusive features. And you can find the full list of the contributors, the partners, and the co-applicants in the About section. So Today, we are going to learn how the eCOVID RecMap catalogs COVID-19 recommendations on a user-friendly map, and how to access best available evidence related to the pandemic from around the world. And so we will start with thinking of how we can find recommendations. The platform allows us to look in different ways. So I can either directly enter what I'm looking for in the search bar. And we'll start with the example on masks, for example. If I'm looking for what recommendations out there are talking about masks, I can just type in mask in the search bar, and it will take me to a list of all the recommendations that have the word mask in them. Or I can choose to start with a map view and then look on the map for recommendations that use the term masks. The way the map is built is that it presents the populations on the left, so in the rows, and the interventions under the main intents in the columns. This means that every recommendation that we capture, we split it into its PICO elements, so the population, the intervention, and the comparison. And we have a coding system to allow every population and every intervention to be matched with international classifications, such as ICD-11. And then we categorize interventions based on the main intents, and those are infection control, vaccination, screening, diagnosis, treatment and rehabilitation, prognosis, planning and monitoring, and health systems and services. So when I'm looking for masks, I can either decide to just take a look at all options, or for example, if I know my specific interest is infection control, and I can look under infection control. I want to look at face masks in students, for example. I have the intervention, face mask, and students as a population. And the intersection cell will show me all available guidance and recommendations on a certain combination of population and intervention. So what we're saying is that we can use the word that we're looking for as a keyword, or we can start by looking through what is available on the map itself. So if I was aware that I'm strictly looking for infection control, I could start with infection control, go to face mask, and then look at the populations that have been covered by recommendations on face masks. If I was interested in recommendations on heparin, for example, I can type in and directly access the list view. It will show me the list of all recommendations and guidance on heparin. Now, as you see, we have a set of filters on the right. These filters are available both on the list view and on the map view. The filters help us specify our search. Either we're interested in recommendations coming from a specific organization, and so we can specify that. So for example, if I'm looking for heparin or any anticoagulation, I would be interested in looking at the American Society of Hematology's recommendations, for example. And then I can also choose the world region that the guideline is covering. We can decide to split our results by age group. And here we're only seeing adolescent and adults because all heparin recommendations so far that are included in our map only cover adolescents and adults. Or we're interested in any coexisting condition for those taking heparin, the intended population, healthcare workers and hospitals, for example. And what we're adding here to this map is the recommendation type. So this might be new to some of you, and this is coming from a framework that the team has put together, building on other people's work from before, building on previous literature, and also our own work with the TB recommendations map, and looking into many published guidelines and some of the big number or big volume of information that comes within a guideline. We have developed a framework that allows to differentiate between what is a formal recommendation that is actionable, that is graded, that provides a certainty in the evidence, and what is a good practice statement, which is a statement that guideline panels feel are important to issue, but that are not appropriate for formal ratings of certainty of evidence, and what we are labeling as additional guidance, and that would be the category where we categorize anything that does not fall under formal recommendation or good practice statement. So for example, here we have one recommendation on heparin. When we access it, we will be able to see the intent of this recommendation, the full recommendation as it is, and then the certainty in the evidence, the strength of the recommendation, and the agree score. So to look at the details here, the components of a recommendation, so the recommendation statement itself, are taken verbatim from the guideline document that is published by the organization. The certainty of the evidence and the recommendation strength are also taken as they were published by the guideline developers. Our team is using the Agree2 tool, which is a tool to assess the methodology of guidelines, to provide a score per domain for 3 of the 6 domains for Agree. So the Agree2 tool, if you're not familiar with it, has 6 domains, and we have chosen the 3 that reflect the most on credibility of guidelines. And we're presenting the results of these 3 domains. Usually the score per domain is a percentage. And the purpose of it is to inform users, mainly guideline developers or researchers, on the quality as per the Agree2 score. So that's something that our team is doing. And then we present the details of the recommendation, the population, the intervention, and we linked to the EML, so the Essential Medicines list by WHO. Any recommendation that has a pharmacological intervention provides a link directly to the Essential Medicines list. So for example, here we have heparin. If we click on it, we'll directly go to the description of and the details of heparin on the EML list. Additionally, we are linking to living evidence platforms. So for example, the Love portal by Epistemonicus. And so for every recommendation, our team is finding the list of evidence that is available on the Love platform using the combination of population and intervention that were provided for this recommendation. Moreover, there's another link to the NIPH Living Evidence Map. And in that map, we also see the all the evidence synthesis pieces and primary evidence on COVID-19, depending on the population intervention combinations. So this might take a bit of time to load. I'll just leave it here and come back to it later. The purpose of linkages to these living evidence portals is that we want to make it easier for users to find the evidence, specifically if they're interested in contextualizing a certain recommendation. And so they will directly be looking at the recommendation, the information specific to this recommendation, and then directly looking at what evidence, what is the available evidence out there. And here we go. This is the NIPH, so the Norwegian Institute of Public Health in collaboration with McMaster and Evidence Prime. And so, the EpiMapper have built this map. It's a living map of evidence for COVID-19. So from this view, I can either choose the menu on the right to go to the summary of choices, for example. And here we report on the all the judgments that have been made on the evidence to decision framework if it was reported in the guideline. We also report on the source of the recommendation and all the details of that. So the publication year, the guideline group details, whether consumers were engaged, whether people with lived experience of COVID-19 were engaged, whether any non-English databases were used in the search for the evidence, the full reference to make it easier for users to directly go to the guideline along with the source link and the identifiers. The version, whether it's final or a draft. some of the guidelines right now, because of the urgency, are being published in a draft version and then in a final version. We're also providing information on whether a declaration of interest was provided, whether a guideline was whether the guideline from which this recommendation came from was described as rapid or living, the latest literature search date, what kind of grading or what grading method was used, so whether it's the grade approach or other, and if other, what other methodology was used, who the intended users of the guideline are, what the field, what field this recommendation covers, the world region, and the country. So this is a typical view of a formal recommendation. The difference that we'll see between the formal recommendation and a good practice statement, for example, is that a good practice statement is not accompanied by grading or a certainty in the evidence, and so we will not see it here. We will see typically the information similarly to the formal recommendation with linkages to other maps. But in addition to that, you will be able to see the 5 criteria we have used to judge a certain statement on whether it falls under a good practice statement. So for example, our team looks at the statement and checks on whether it is clear and actionable, whether the message is really necessary in regard to actual healthcare and practice, whether after consideration of all relevant outcomes and potential downstream consequences, implementing the good practice statement results in large net positive consequences, if collecting and summarizing the evidence is a poor use of a guideline panel's limited time and energy, and whether there's a well-documented, clear, and explicit rationale connecting the indirect evidence. And so our team typically uses these 5 criteria, provides their judgment, and provide the reasoning why they were able to make this judgment. We are aware that different developers and different users might not be familiar with this classification, and that's why we're providing it transparently. And of course, any developer who considers that there might be any misjudgment here is able to contact us, and we are working collaboratively to make sure that everything is reported here as it should be, and the developers are aware of what we are reporting. So this was the good practice statement view. And then when we are facing any additional guidance type of statements, it's also the statement without any grading and with the information that is related to it. So maybe I can take any questions here about the map. Let me check the chat box. Any questions or any specific example you would like us to test? Why is it called living? Great, that's a great question. Well, it's living because we are continuously adding anything that comes through our search team. So the way we capture recommendations is that we have a team that looks at the different at the published guidelines. And so our search is looking into a long list of databases and organizations. So for example, we have a pre-filtered search that looks into PubMed, and then we have the World Health Organization, ECRI, the National Institute for Healthcare and Health and Care Excellence, NICE, the International Database of Great Guidelines, the big database, the Guidelines International Network Library. And in addition to those, we have manual searches looking into the different websites and databases. The search is updated on a regular basis, at least twice monthly. And for some databases, it goes on a daily basis. And we are trying to keep the content as relevant as possible. How do you integrate the different grading systems? Great, that's a great question, thank you. So right now we are reporting the grading that comes from grade. For anything that's coming from different grading system, we are trying to make, so there's a certain translation that a group, that a team that's part of our bigger team has put together to translate between different grading systems. And we'd be happy to share that with everyone once that is published. We know it's been submitted and waiting for publication, and it shows how to translate the different grading systems. Now, one thing to, this is actually a good question, because it points out that some other grading systems, for example, have a classification for research recommendations, for example. And we have identified those. And so far, what we're doing for any research recommendation is that we're providing the indication next to the statement that this is a research recommendation. And it is mainly provided under additional guidance. So if you go under additional guidance, you'll also be able to see research recommendations. Otherwise, we are not making any judgments ourselves in any recommendation or guideline where we face any difficulty or challenge, or we feel that some information might be different or not enough. We are reaching out to the authors. And to say that before we publish any recommendations on our map, we inform the authors of the guideline that their guideline has been captured. We have a team member who's actively contacting and reaching out to the guideline developers, informing them that we have captured guidelines from their end, that the guideline will go under critical appraisal. So we will use the agree-to and provide that our scores on the website transparently, and that the recommendations will be included in our map. Typically, some developers reach back asking, for example, for some clarification on how we've done our scoring. And of course, we provide them with that, and we are open to discussion. So next question is, how are good practice statements developed? Thanks, Tina. So typically, so far, we are finding these good practice statements, similarly to inform recommendations and so on, as part of the statements within a guideline. So again, so far the work is being done backwards. So we have the guidelines published, we have a set of statements, and we're trying to fit each statement within the framework. By definition, the good practice statement is a statement that the guideline panel has put together, they have developed, they have followed a process, but putting in more time to look for the evidence would be a waste of time. The message is necessary in regard to actual healthcare practice. It's clear and actionable, and it's, they provide a well-documented and clear and explicit rationale connecting the indirect evidence. And so right now what we're doing is that we're classifying these statements. We are not developing any of these statements, of course. We are reporting what is published out there. So the next question is, did you find strong recommendations based on low or very low certainty of the evidence? Also, is there a way to search for strength of recommendation? So thanks for that question. I can't make that, I can't give you an answer right now, as this was not one of our main findings in terms of strength of recommendation based on certainty of the evidence, but the data is available. So we'd be happy to follow up on this with you to look into what's available if it's of your interest. And in terms of searching for strength of evidence, for strength of recommendation, it is possible to add that filter. So please, if you haven't yet, we have a usability survey that's available in our About section, under the About section on the map. It would be great if you can provide such comments or suggestions in that survey. We take the comments that we receive very seriously, and we would like to make any modification that is suggested. Great, thank you. So any other questions about the map or about how to access information through the map? Okay. So the other objective that we had planned to cover today is the contextualization. So what we are providing through this map is that when a user has identified a recommendation of their interest and they would like to contextualize it, so they would like to adapt it, so make the modifications that are necessary for it to fit their local context, they can click on request for a development. They will be able to complete very basic information. So just the name, the email address, and any information they have on the process that they want to follow. So whether they have a guideline team, how they plan to organize the development or the contextualization, and how many people they have on the team. They can send the request, and then someone from our teams will be in contact with them to provide them access to the GradePro project. So GradePro is the tool that we use to usually to develop guidelines, and that we have now customized to link to this map and to keep the content living. And so they will be provided with access to the project on GradePro, and the module for development will be activated there, meaning that they will be able to take the information related to the specific recommendation and look at the evidence based on where they are based and so on. They can look for feasibility related evidence, acceptability. So for example, here we have the ETD, the evidence to decision framework, that was reported for one of the recommendations. And again, we just report these as they have been published by the developers. And those interested in developing a recommendation will be able to look for each criteria for evidence through our portal, and they will be supported to make decisions in terms of these specific criteria to generate a new recommendation that is modified to fit their context. So can you let me know in the chat box if you're familiar with GradePro? Great. Great. And so, for example, if you are interested in contextualizing any of these recommendations, if you are currently planning to develop a guideline, have not looked yet for whether guidelines in other countries have been developed, but that answer the same PICO question, then you can look for the recommendation of your interest and again, just complete the request for a development. And our team will assist you in terms of moving forward with the development process. And again, we follow the Great Evidence Decision Framework, the set of criteria, and we are happy to provide you with the support. Now, the third objective for today's session is to learn how to get more involved with the recommendations map. So we are open for collaboration. As mentioned before, we have a list of collaborators and partners who have been engaged in the conceptualization and the development and the implementation of the different steps for making this map possible and live and living. You can reach out depending on what it is exactly that you are interested in doing. So for example, again, if you're planning to develop a guideline on COVID-19, you can reach out so that we grant you access to the software behind this map. So the GradePro version specifically for this map, you will be able to develop your guideline in that software, and then directly we'll be able to push it to our map. If you are planning to do any contextualization or development, we can provide you with access to GradePro with the copy of the original project that was used to develop the original recommendation and support you through the contextualization. And if you would like to volunteer in terms of helping the team in the extraction or the critical appraisal, there's also, we can look into making that possible. Now, to mention that a French version of the map is currently under development. So users will be able to access all the information both in English and in French. And one also important point to mention is that all the guidelines that are captured here are coming from the searches that are not restricting for language. So our searches are looking into as many languages as possible when doing the search. And we have collaborated with different teams across the globe and reached out to Cochrane Exchange members, the Cochrane Task Exchange members, and other networks across the world. So if you are capable of supporting in a certain language and identifying guidelines that you believe we have not included yet, please feel free to reach out. We'd also be happy to support, again, on a volunteer basis, we're welcome to do, we'd be happy to do that. For any instructions, we have tried to provide all instructions possible on the map. So for example, if you're not sure how to start with your search, you can directly click on what you can do on this portal, and it explains to you the different the different elements. So whether you want to use a search bar, whether you want to look through the COVID list of recommendations, through the map. And if you have any difficulty understanding any of the terminology we use, you can go to the three stripes on the right. We provide the glossaries. So there's a glossary for all the terms that we use and the strength of recommendation and what it could mean to different users. We also provide a link to the grade handbook glossary in case you are not familiar with the grading system. And the additional thing is that we have identified a list of guidelines that are not directly targeting populations of people who are suspected for COVID-19 or confirmed with COVID-19 or at risk for COVID-19. But mainly provide guidance on the change of care in times of COVID. And so we have put all these guidelines together in one list that you can access and that you can search. We have not extracted information from these unless they contain recommendations that specifically address populations with high risk for COVID-19, suspected or confirmed. And so you can find such recommendations in the map. Otherwise, these guidelines would be listed here, and you can access them directly from our map, from this page. Now, we always have things that are upcoming. For example, we're also going to be able to be adding guidelines specifically looking at pandemic preparedness. And as I mentioned, there will be a French version of the map. And the last thing that we will be working on, that we are working on right now, is the knowledge base. And that is a platform that will allow you to look into more resources, and specifically for anything that's coming to us, and the feedback survey in terms of what other guidance we can provide will be available on that knowledge base. We're also working closely with a consumer engagement specialist and to continuously make sure that our map is as user-friendly and as possible, and that it is relatable to as many stakeholders as possible. So if you have any input on that, also please do provide that input within the comments and the feedback survey. Can I take any other questions? And please feel free to just provide us with input if you've already used this map or it's just learning about it now, but you'd like to give any comments or input, please feel free to do that. Thank you for this question. So to be a partner of this project, you just need to send us an email and we can work on that. So I will provide my email in the chat box, and then I can link you with the team. So I'll providing my email and the emails of the other two co-leads, and those are Holger Schunemann and Adrian Stevens. And these will be coming right away in the chat box. Any other questions? And again, if you'd like me to test any specific example, or if you have any specific topic in mind you'd like to look for recommendations for, please do let me know. We'd be happy to do that. Going through the map. Thank you, Tina, for your comment. Thank you. It's really been a great work so far, collaborating with a very big team, and we have a committed team really who's working on the hour to make sure that we're capturing the guidelines as soon as they're out. We have a very rigorous process to make sure that one guideline takes up to 9 days from its publication until it's uploaded here on the map. As you know, the guidelines, some of them include 10 recommendations, other might include 100 recommendations. So if you realize that a guideline that you've worked on that's published is still not on the map, please feel free to drop us an email and we can make sure that we've captured within our list. Thank you for the comments. Definitely, Tina, it's very important to share with policymakers and decision makers, and please do feel free to get back to us with any comments that they provide, especially if they are planning to implement any contextualization, or if they have any suggestions on making the map more accessible. Is it possible to have the recording? We will have to go through and educate others not to use. So of course, I think we are going to make the recording available. And also just to let you know that if you go to the About section, there's a set of slides that explain what the project is about and so on. And if you, we'd be happy to provide you with updated slides in case there were any updates and any other kind of support needed to facilitate the use of the map. Guidelines on antiplatelet therapy and got my answer at last. That's amazing. Thank you, Rena, for that comment. Great to know. All right. So if there are no more questions or comments. Okay, so we have a comment from okay, so just to confirm to everyone, the recording will be available in the coming days. That's great. And please make sure to follow us on Twitter for any updates from our website. You can directly go to our Twitter page and just follow us and stay tuned for any updates that we will be bringing to this map. Great. So thank you everyone for joining. And stay tuned for the next sessions. We will also send you emails about the next webinars on this map so that you can learn more about other things that we're doing within this project. Thank you.